Question 1. A child with croup has stridor and difficulty breathing. What is the nurse's priority action? A. Start 4 fluids. B. Assess airway. C. Give cough syrup. D. Check temperature. Correct answer, B. Assess airway. Rationale: airway always comes first. Croup causes airway obstruction. Strategy: ABCs first, airway before everything. Question 2. Which finding indicates dehydration in an infant? A. Wet diapers. B. Sunken fontanelle. C. Tears present. D. Moist mucous membrane. Correct answer: B. Sunken fontanelle. Rationale: sunken fontanelle is a classic sign of dehydration. Strategy: think dry equals sunken. Question 3. A child with tetralogy of Fallot becomes cyanotic. What should the nurse do first? A. Lay child flat. B. Knee chest position. C. Give oxygen. D. Call physician. Correct answer, B. Knee chest position. Rationale: knee chest improves oxygenation. Strategy: TET spells equals knee chest. Question 4. Which is the best toy for a toddler? A. Puzzle. B. Coloring book. C. Building blocks. D. Video game. Correct answer, C. Building blocks. Rationale: toddlers enjoy stacking and building. Strategy: toddler equals build plus push plus pull. Question 5. Which is a sign of meningitis in infants? A. High BP. B. Bulging fontanelle. C. Bradycardia. D. Constipation. Correct answer, B. Bulging fontanelle. Rationale: increased ICP causes bulging fontanelle. Strategy: meningitis equals bulging fontanelle. Question 6. A child with epiglottitis is admitted. What should the nurse avoid? A. Oxygen. B. Tongue depressor. C. 4 fluids. D. Antibiotics. Correct answer, B. Tongue depressor. Rationale: can cause airway obstruction. Strategy: never look in throat with epiglottitis. Question 7. Which indicates respiratory distress in infants? A. Smiling. B. Nasal flaring. C. Sleeping. D. Feeding well. Correct answer, B. Nasal flaring. Rationale: nasal flaring equals respiratory distress. Strategy: flaring equals trouble breathing. Question 8. A child with nephrotic syndrome shows what sign? A. Edema. B. Weight loss. C. Dry skin. D. Bradycardia. Correct answer, A. Edema. Rationale: protein loss causes swelling. Strategy: nephrotic equals puffy child. Question 9. Which is the first sign of increased ICP? A. Bradycardia. B. Irritability. C. Hypertension. D. Fixed pupils. Correct answer, B. Irritability. Rationale: early sign equals irritability. Strategy: early ICP equals irritable child. Question 10. A child with asthma attack. What is priority? A. Give fluids. B. Give bronchodilator. C. Check BP. D. Encourage sleep. Correct answer, B. Give bronchodilator. Rationale: opens airway. Strategy: asthma equals bronchodilator first. Question 11. Best indicator of fluid balance in infants? A. BP. B. Pulse. C. Daily weight. D. Temperature. Correct answer, C. Daily weight. Rationale: most accurate measurement. Strategy: weight equals best fluid indicator. Question 12. Which child is priority? A. Fever 101 degrees Fahrenheit. B. Stridor. C. Rash. D. Vomiting. Correct answer, B. Stridor. Rationale: airway emergency. Strategy: airway equals priority. Question 13. Which indicates hypoglycemia in newborn? A. Jitteriness. B. Crying. C. Sneezing. D. Smiling. Correct answer, A. Jitteriness. Rationale, low glucose causes jitteriness. Strategy, jittery baby equals check sugar. Question 14. Best toy for school-age child? A. Rattle. B. Coloring book. C. Board games. D. Mobile. Correct answer, C. Board games. Rationale, school age enjoys rules and competition. Strategy, school age equals competitive play. Question 15. Child with RSV requires A. Airborne isolation. B. Droplet. C. Contact. D. Reverse. Correct answer, C. Contact. Rationale, RSV spreads by contact. Strategy, RSV equals contact. Question 16. Which is sign of pyloric stenosis? A. Projectile vomiting. B. Diarrhea. C. Fever. D. Rash. Correct answer, A. Projectile vomiting. Rationale, classic symptom. Strategy, projectile vomiting equals pyloric stenosis. Question 17. Which is sign of intussusception? A. Jelly stool. B. Dry stool. C. Bloody urine. D. Vomiting only. Correct answer, A. Jelly stool. Rationale, current jelly stool. Strategy, jelly stool equals intussusception. Question 18. Which child is priority? A. Fever. B. Cyanosis. C. Cough. D. Rash. Correct answer, B. Cyanosis. Rationale, oxygenation issue. Strategy, blue equals priority. Question 19. Which indicates otitis media? A. Ear pulling. B. Smiling. C. Eating well. D. Sleeping well. Correct answer, A. Ear pulling. Rationale, classic sign. Strategy, pulling air equals infection. Question 20. Which is sign of Kawasaki disease? A. Strawberry tongue. B. Blue lips. C. Rash only. D. Fever only. Correct answer, A. Strawberry tongue. Rationale, classic symptom. Strategy, Kawasaki equals strawberry tongue. Question 21. Best position after tonsillectomy? A. Supine. B. Side lying. C. Sitting. D. Flat. Correct answer, B. Side lying. Rationale, prevent aspiration. Strategy, tonsillectomy equals side position. Question 22. Which indicates bleeding after tonsillectomy? A. Frequent swallowing. B. Sleep. C. Talking. D. Crying. Correct answer, A. Frequent swallowing. Rationale, blood trickling. Strategy, swallowing equals bleeding. Question 23. Child with burns priority? A. Pain. B. Airway. C. Nutrition. D. Dressing. Correct answer, B. Airway. Strategy, burns equals airway first. Question 24. Which indicates appendicitis? A. RLQ pain. B. LLQ pain. C. Back pain. D. Headache. Correct answer, A. RLQ pain. Question 25. Which is sign of Down syndrome? A. Flat face. B. Tall height. C. Long fingers. D. Curly hair. Correct answer, A. Flat face. Question 26. A child with sickle cell crisis, what is the priority nursing intervention? A. Restrict fluids. B. Give oxygen. C. Encourage activity. D. Cold compress. Correct answer, B. Give oxygen. Rationale, sickle cell crisis causes hypoxia. Oxygen reduces sickling. Strategy, sickle cell equals oxygen plus fluids plus pain control. Question 27. Which finding indicates diabetic ketoacidosis, DKA? A. Sweet breath. B. Fruity breath. C. Sour breath. D. Normal breathing. Correct answer, B. Fruity breath. Rationale, ketones cause fruity breath. Strategy, DKA equals fruity breath plus Kussmaul breathing. Question 28. Best toy for an infant? A. Board game. B. Rattle. C. Puzzle. D. Coloring book. Correct answer, B. Rattle. Rationale, infants enjoy noise and movement. Strategy, infant equals rattle. Question 29. Which child is priority? A. Fever 101 degrees Fahrenheit. B. Seizure. C. Rash. D. Mild cough. Correct answer, B. Seizure. Rationale, seizure threatens airway and safety. Strategy, seizure equals emergency. Question 30. Which indicates hydrocephalus? A. Small head. B. Large head circumference. C. Sunken fontanelle. D. Dry skin. Correct answer, B. Large head circumference. Rationale, CSF buildup increases head size. Strategy, hydrocephalus equals big head. Question 31. Child with fracture, priority assessment? A. Temperature. B. Neurovascular status. C. Pain level. D. Skin color only. Correct answer, B. Neurovascular status. Rationale, prevent compartment syndrome. Strategy. 5 P's equals pain, pulse, pallor, paresthesia, paralysis. Question 32. Which indicates sepsis in newborn? A. Fever only. B. Temperature instability. C. Crying. D. Sneezing. Correct answer, B. Temperature instability. Rationale, sepsis causes unstable temperature. Strategy, newborn sepsis equals temperature instability. Question 33. Which indicates autism? A. Smiling. B. Eye contact. C. No eye contact. D. Talking early. Correct answer, C. No eye contact. Rationale, social interaction deficit. Strategy. Autism equals poor social interaction. Question 34. Infant choking, first action? A. Abdominal thrust. B. Back blows. C. CPR. D. Oxygen. Correct answer, B. Back blows. Rationale, first line for choking infant. Strategy, infant choking equals back blows. Question 35. Which indicates bronchiolitis? A. Wheezing. B. Headache. C. Rash. D. Vomiting. Correct answer, A. Wheezing. Rationale, RSV bronchiolitis causes wheezing. Strategy, bronchiolitis equals wheezing infant. Question 36. Which indicates anemia? A. Pallor. B. Red skin. C. Rash. D. Fever. Correct answer, A. Pallor. Rationale, low RBC causes pallor. Strategy, anemia equals pale child. Question 37. Which indicates UTI in child? A. Fever. B. Cough. C. Rash. D. Sneezing. Correct answer, A. Fever. Rationale, fever is common sign in children. Strategy, fever without source equals think UTI. Question 38. Which vaccine is given at birth? A. DPT. B. Hepatitis B. C. MMR. D. Varicella. Correct answer, B. Hepatitis B. Rationale, given at birth. Strategy, birth vaccine equals Hep B. Question 39. Which indicates measles? A. Koplik spots. B. Rash only. C. Fever only. D. Cough. Correct answer, A. Koplik spots. Rationale, classic measles sign. Strategy, measles equals Koplik spots. Question 40. Which indicates mumps? A. Swollen parotid gland. B. Rash. C. Fever. D. Cough. Correct answer, A. Swollen parotid gland. Rationale, classic symptom. Strategy, mumps equals chipmunk cheeks. Question 41. Which indicates rubella? A. Rash. B. Vomiting. C. Diarrhea. D. Headache. Correct answer, A. Rash. Rationale, rubella causes rash. Strategy, rubella equals rash. Question 42. Child with diarrhea, priority? A. Antibiotics. B. Hydration. C. Food. D. Sleep. Correct answer, B. Hydration. Rationale, prevent dehydration. Strategy, diarrhea equals fluids first. Question 43. Which indicates lead poisoning? A. Developmental delay. B. Fever. C. Rash. D. Vomiting. Correct answer, A. Developmental delay. Rationale, lead affects brain. Strategy, lead poisoning equals development delay. Question 44. Which indicates rheumatic fever? A. Joint pain. B. Rash. C. Vomiting. D. Cough. Correct answer, A. Joint pain. Rationale, migratory joint pain common. Strategy, rheumatic fever equals joint pain. Question 45. Which indicates ADHD? A. Calm behavior. B. Hyperactivity. C. Sleeping. D. Quiet. Correct answer, B. Hyperactivity. Rationale, ADHD causes hyperactivity. Strategy, ADHD equals hyperactive child. Question 46. Child with febrile seizure, first action? A. Restrain. B. Protect airway. C. Give fluids. D. Call parents. Correct answer, B. Protect airway. Rationale, prevent injury. Strategy, seizure equals airway plus safety. Question 47. Which indicates dehydration? A. Dry mucous membrane. B. Wet lips. C. Tears present. D. Moist skin. Correct answer, A. Dry mucous membrane. Rationale, dehydration sign. Strategy, dry equals dehydration. Question 48. Which indicates congenital heart defect? A. Cyanosis. B. Rash. C. Fever. D. Vomiting. Correct answer, A. Cyanosis. Rationale, oxygenation problem. Strategy, blue baby equals heart defect. Question 49. Which indicates pneumonia? A. Retractions. B. Rash. C. Vomiting. D. Crying. Correct answer, A. Retractions. Rationale, respiratory distress sign. Strategy, retractions equals respiratory distress. Question 50. Child with allergic reaction, priority? A. Give antihistamine. B. Assess airway. C. Give fluids. D. Check temperature. Correct answer, B. Assess airway. Rationale, airway compromise risk. Strategy, allergy equals airway first.